About to get started here. I didn't even get things set up either the way that I wanted to, but it's okay. I can always wing it. And I am going to be putting up some infographics this week if they haven't already been posted. I haven't even checked for today. That are gonna reiterate some of the things that we go over here, so that even if you don't take notes or whatever, you'll be fine. So don't worry. And the infographics have nice little graphics on them, so you can post it in your on your refrigerator, things like that, if you'd like to remind yourself. So today we're going to be talking about the basics of what I recommend to my patients. No matter what's going on, there's like some basic issues that need to be addressed before we start talking about specific items to address some of the complaints that we talked about yesterday, or some of the issues that come up with COVID long hauler. So COVID long hauler, one of the reasons why people get it or can't kick the COVID sequelae or the post-acute issues that come up from COVID is because they most likely have problems with the digestion that are pre-existing, that have just been ignored. They most likely have nutrient deficiencies that have not been detected, because in primary care, they don't usually look for them. They may look for like B12, but even when they check B12, they're not checking the correct item. So, and with vitamin D, it's the same thing. Sometimes they're not checking the correct form of vitamin D. Many times people have deficiencies in zinc, and they're not checking that either. So if you look at my website, you'll see that I have a pentagon-shaped type of graphic showing the main areas for wellness and for health. These include nutrition, sleep in the nervous system, I include that together. The mental, emotional, spiritual aspect or / relationships. It's kind of like what's going on in your life and how's it affecting you. And then movement and exercise. So movement and exercise are one in the same category, because this is controlling part of the metabolism that has to do with the health of the mitochondria. So many times when people have toxicity from these chronic illnesses, the mitochondria are not working well. The mitochondria might not be working well because the mitochondria is not able to overcome the toxins that are kind of overtaking it within the cell. The mitochondria is in the nucleus of the cell, and it's the part of the cell that's responsible for making energy. So having that mitochondria in a tip-top shape requires movement of the body and exercise. So we got nutrition, we got sleep in the nervous system, we've got the mental, emotional, spiritual or relationships, and we have movement and exercise. And the last thing is stress. So stress is probably the most important factor in determining disease and recovery from disease. And oftentimes people are just stuffing down their stress, and that is causing damage to the body and causing the body to not be able to handle stress well. So we'll just recap all those again. And as we recap them, I'm gonna just talk about a little bit of detail within each. So first, we're gonna talk about nutrition. So nutrition is an area where Americans have a lot of neglect, and many Americans in the current generation have not learned how to eat nutrient-dense food. And I say this based on my experience of people that come into my practice. And many of them believe that they're eating well and that they're taking care of their nutrition well, but many are not aware that processed foods are anti-nutrients and can also contribute to malabsorption of nutrients. So many people are eating foods that are not nutrient dense and are in fact anti-nutrient. So this requires education, which in my experience takes about 3 to 6 months. Okay, so nutrition. As an overall recommendation, I tell people to start with an anti-inflammatory diet. And an anti-inflammatory diet would be, an example is a modified Mediterranean diet. And that's something you can just look up online. You know, I have my parameters that I use, and if you're interested in working with me, you can book an appointment to meet with me one-on-one for free for 10 minutes, and we can talk about it. So then the next category, I'm going to recap briefly, was the fitness or exercise or movement. So the prescription for fitness, exercise, or movement can be very specific. I was just meeting with someone earlier today who had a history of rheumatoid arthritis. As an example, someone with rheumatoid arthritis should not be running, should not be doing high impact exercise. It seems obvious, but it may not be to some people. There are certain types of exercise that we'll prescribe for somebody with rheumatoid arthritis when they're having a flare. We'll prescribe exercise a certain way. When they are in better health, we'll prescribe other exercises that are going to be low impact, but are still going to help them to move their joints. So when people have a flare, they have to have less joint movement, and moist heat is usually helpful. So the reason why I know a lot about prescribing exercise is because I have a background in rehab medicine. I'm boarded in rehab medicine. And in rehab medicine, we have to learn how to prescribe for everyone. So when people have spinal cord injury, brain injury, when they have lupus, arthritis, when kids have cerebral palsy, anything you can think of, we have to be able to prescribe for them. So I can prescribe for anybody, even someone who's paralyzed from the neck down. There are things that we prescribe. So, and we always want to prescribe some type of exercise because we know that this helps to optimize the energy creating mechanism inside the cell that I was talking about before, called the mitochondria. There's certain exercise that can benefit certain diagnoses, like when people have diabetes, it's best for them to do weightlifting. So what we're finding with COVID long hauler is, you know, people may have fibromyalgia, which is diffuse pain, that requires a certain type of exercise prescription. They may have a situation with a lot of inflammation, and that may require a certain type of prescription. So actually people in physical medicine and rehab, or people certified in physical medicine and rehab, are becoming the experts for treating people with COVID long hauler because of our experience in dealing with chronic fatigue, fibromyalgia, brain injury, spinal cord, a lot of situations. All right, so then the third thing I'm going to talk about here is sleep in the nervous system. So sleep and problems with the nervous system are often causing or related to issues with hormonal imbalances and with chronic systemic inflammation. So this is something that requires detective work. We have to ask certain questions, and it's very specific to the person that's having the problem. One person may have a sleep disorder that's not been detected because no one recognized it from the symptoms or from the clinical presentation. There's also problems that may arise with nutrient issues contributing to the sleep and nervous system disorders. There may be hormone issues contributing. So sleep and the nervous system is an area that can be complex. The person may need to have a sleep study to determine what's going on. The person may need specific medications that address certain areas of having sleep issues, or they may need certain nutrients. Some of the nutrients associated with problems with sleep are B6, B12. You can have problems with your sugar balance that can cause you to not be able to sleep. With your mineral balance, things like potassium, magnesium, calcium can affect the ability to sleep, and also the integrity of the nervous system. Choline and inositol can also be nutrients that are involved with sleep and the nervous system. So it can be nutrient related, it can be sleep hygiene related. COVID itself can cause brain inflammation that affects the sleep. All right, so then fourth thing is we're going to talk about mental, emotional, spiritual relationships. So this is the central issue of all illness, the mental, emotional, spiritual. So we are going to, that's a very specific area where it's very individual. For instance, someone can have childhood trauma, adverse childhood experiences that can influence the illnesses that they're holding inside their body. And then when they get COVID or some kind of chronic situation, it can be hard for them to heal because they already had a mechanism within their body that was causing illness. So that's just one example. But you get the idea that the mental, emotional, spiritual is like the hub of the wheel. If that is not working right, if the energy is not right within the person, they will not heal. The healing process will not begin. So then the last area, which is related to the area that I just talked about, is stress. So stress can involve hormones, things like cortisol, the fight or flight hormones, and neurotransmitters. And stress, of course, is mediated by our energy. And we know about energy in the body from traditional Chinese medicine, from Ayurvedic medicine. We know about it from African and indigenous-based medicines, that energy is really controlling the systems in the entire body. So it's important to get some kind of energetic assessment so that the energy can be optimized and so the stress can be minimized. Many of us need to learn coping mechanisms or even treatment mechanisms for addressing stress. I'm certified in neuro-emotional technique, and that is based on acupressure points within the body. And we're able to use those and get the energy to circulate properly. There are many different methods of energy medicine that can be used to get the energy to circulate properly. There are waveforms using pulse electromagnetic frequency. There is sound. There is tapping. There are so many things. There are books written that are inches thick. So this is an area where I tend to customize it for the patients that I'm dealing with. And in my group courses, I tend to expose people to a number of different therapies and try to help them find one that may work for them. So those are all the 5 areas that I feel are the major areas of the lifestyle factors that need to be addressed before we can even start talking about addressing individual symptoms with the COVID long hauler. So the reason why people have COVID long hauler, in my opinion, because research is being done, but I guarantee it's going to take at least 20 years for them to figure out things that we already know in integrative and functional medicine. So in integrative and functional medicine, we're used to dealing with chronic mold, with fibromyalgia, with chronic fatigue, with foggy brain, with leaky gut, with digestive issues that are chronic, like irritable bowel. So these come under these issues that I mentioned, and these pillars or these lifestyle factors that I mentioned. Nutrition was the first one we reviewed. Number 2 was the fitness, exercise, or movement. Number 3 was the sleep and the nervous system. Number 4 was the mental, emotional, spiritual, or relationships. Number 5 was stress. So you can come back here and look at a review of this video. I know I've gone over. I started around 15 after 6. I started late today because I had a patient that went a half hour over. So I apologize, but sometimes it can't be helped. Tomorrow for sure, I'll be here on time. I do not have late afternoon patient tomorrow, so I will be here at 6 tomorrow. I hope that you learned something from this session today. You can come back and look at the live video once I post it in a few minutes. And tomorrow, we're going to get into more specifics addressing, like, what types of supplements we use to address certain things that come about with COVID long hauler. However, I wanted to refer you back to what I talked about today, because today is a foundation. And if you have not addressed the foundation, the inflammatory factors are not going to be well controlled if you have not addressed the foundation of health and wellness. So, all right. Let's see. I see Mark Joseph, hi. Let's see, and I see, who else do I see? Greg Newton, welcome. And Cub Ehole, welcome. So thank you so much for coming by. I keep these brief every day. And tomorrow will be the 3rd day, and you can go back and look at the video from yesterday where we talked about the symptoms. And also the last day, we'll be putting it all together, and we'll be talking about what you can do once you understand all these areas that I've been talking about and the issues, the symptoms that I've been talking about this week. So many people will require someone to help them put a plan together, or someone knows how to direct them on where to get started, because this is a complex medical issue. It's usually not something that you're going to be able to resolve on your own quickly, unless you already had experience in dealing with something like I already mentioned, like chronic mold, like chronic fatigue, like fibromyalgia, because the approach is going to be similar. Chronic pain is another issue. I see my colleague, Dr. Darlene, has joined now as well. So, all right. All right, so Mark Joseph, I see that you sent a request to be in my live video. Not sure if I can do that. You can watch this video after I close it out, because that's what I think you want to do. It will be posted on my Instagram. So you can just come back to the Instagram page and click on live, and you'll be able to view this video. Also, on my page, if you want to access getting the free 10-minute one-on-one, I usually either do those by phone or I do them asynchronous. And asynchronous means that we're going back on and forth on messaging. So I'll ask you specific questions when you're booking the appointment, and we'll spend that 10 minutes going back and forth. Or I really like talking to people on the phone more often, but remember it's 10 minutes. So after 10 minutes, I will suggest, if you're interested, that you book a longer appointment. On my website, you can access the link for the longer appointment and for the 10-minute, and that's at treatyourself2health.com. On my Instagram, you can access the link tree. At the top of the page, it says link tree, and it has a link. You can click on that and you will see a whole menu of things on the link tree. So you can get free PDFs to download. You can access pages where I have communications on other parts of the web. You can also click to schedule. So I hope that's helpful. Thanks for coming today. Sorry I was starting late. Like I said, I had a patient that ran half an hour late, but I will not be late another day this week because I don't have any other scheduling that runs close to this the rest of the week. So thank you so much for coming. I enjoyed talking to you today. All right, take care. Okay. And now, share. Close this out.